second half tomorrow. Kind of break it up a little bit. Okay. I'm sorry I scared some of y'all with the flashcards due today. They're not, no. I just, when I had created the assignment, I just picked a future date and I forgot to go change it. So, anyways, and the date I have on there now is not accurate either. I just pushed it forward. So, okay, well, as always, we'll start with our medical specialties. Bariatrics is a branch of medicine concerned with prevention and control of obesity and associated diseases. So bariatrics, obesity, if you can remember that. Dentist, most of us know what a dentist is. They specialize in diagnosing and treating diseases and disorders of teeth and tissues of the oral cavity. And an orthodontist is a dentist who specializes in preventing and correcting malocclusions of the teeth. So you go to an orthodontist if you want braces or a retainer or something like that. They're going to fix all those malocclusions. A medical specialist as a gastroenterologist is a physician who specializes in diseases and disorders of the stomach and intestines. So if you break that down, gastro means stomach, entero means intestines, and then ologist is a specialist. Proctologist, we just reviewed that procto means anus or rectum. So proctologist is a physician who specializes in disorders of the colon, rectum, and anus. So if you can remember those word parts, that will help you along the way. Okay, tissues of the oral cavity. An aphthous ulcer is also known as a canker sore. They're gray-white pits with a red border. They really hurt if you ever get canker sores. They're not that fun. But it's within the soft tissue lining of the mouth. They're unknown cause of what really causes them, but triggers can be like stress, eating certain foods like spicy foods or things like that, things that are really acidic maybe, and fevers. So if you have a fever, I guess they think you're more prone to them. I get them a lot, but it seems to be mostly like stress or like a toothbrush or some sort of like if I bite my cheek, I might get one or something. Like trauma, I guess you would call it. But they can be pretty painful. There's some pictures. Yummy. Okay. Chelosis is a crack-like sores at the corner of your mouth. Do you ever get those? Oh, it's kind of annoying as well. To me, I think it kind of happens like in the cold or like if it gets really dry or things like that. Again, I think stress, stuff like that can cause it as well. Herpes labialis is also known as cold sores or fever blisters. But that's where you have blisters on your lips and facial tissues, and it is viral. It's a viral infection. So you can pass it along if you have one and you kiss somebody or something like that. You can pass that virus along. Oral thrush is a type of somatomycosis. It's a fungus, Candida albicans. Creamy white lesions on the tongue and cheeks, occurs in children and older people. So, oral thrush or a yeast infection in your mouth. Xerostomia is also known as dry mouth. You have a lack of adequate saliva, and this is because your salivary glands aren't working very well. This can be caused from medications, like certain medications can cause your salivary glands not to function properly, or if you're on radiation, this could be a side effect as well. It does cause discomfort and difficulty swallowing. As you can imagine, if your mouth's really dry, it's kind of like, how do you chew things and swallow without being able to have all that saliva in your mouth? It'd be kind of weird. The cleft lip is a birth defect where there's a deep groove of the lip running upward to the nose. Failure of the upper portion of the lip to close during prenatal development is what causes this. Nowadays, they have so many different like surgery techniques and things like that that can fix this to where it's hardly even noticeable. But they've come a long way with how they repair these. But it is caused by birth defect. There's a failure of the palate to close during early development of a fetus. This can involve the upper lip, hard palate, and or the soft palate. If not corrected, it makes it difficult for the child to eat and speak, as you would imagine. But here's a good little picture. This is probably the most common way that you see. Dental diseases and conditions. Bruxism is the involuntary grinding or clenching of the teeth. This usually occurs during sleeping and it wears away your tooth structures, damages periodontal tissues, and injures your TMJ. I do this really, really bad. It can be caused due to like stress, things like that. Maybe you're not, maybe you have like sleep apnea or something where, you know, there's something disturbing your sleep. But for me, typically, if I'm really stressed, I'm going to be grinding my teeth. And I have had some teeth issues due to it too. Malocclusions are any deviations from the normal positioning of upper teeth against the lower teeth. Again, you're probably going to go see an orthodontist if you have any malocclusions. Dental cavities. How many of you have never had a cavity before? I know there was a few. That's amazing to me. But dental cavities are also known as tooth decay. You can have infectious disease caused by bacteria in there. Destroys your enamel and the dentin of the tooth. And if it's not treated properly, the pulp is then exposed and infected. And that's never good. Then you've got to go possibly have a root canal. And that's never fun. Dental plaque is a major cause of dental cavities. It forms as soft deposits in sheltered areas near the gums and between the teeth. And it consists of bacteria and bacterial byproducts. A lot of times you kind of get it behind like your front teeth, or maybe even in the front on the bottom. But usually right behind those teeth is a really good spot for dental plaque to start building up. Periodontal disease is inflammation of the tissues that surrounds the teeth. It's a progressive disease, meaning it will continue to get worse. It's classified according to the degree of tissue involved. In severe cases, gums, bones, surrounding teeth are involved as well, which is not a good thing. Dental calculus is also known as tartar. Dental plaque that has calcified on your teeth. It can irritate the surrounding tissues and cause increasing serious periodontal disease. This is why it's important for you to go for routine teeth cleanings, because they get all that plaque out before it calcifies. When it starts to calcify, that's when it becomes this big issue and can cause that periodontal disease. Gingivitis is the earliest stage of periodontal disease. It's where inflammation affects only the gums around the tooth. Nice and red. You can kind of see that redness around each of the teeth. But they have pretty teeth, huh? You would think that have some gingivitis. Acute necrotizing ulcerative gingivitis. This is also known as trench mouth. It's caused by an abnormal bacteria in the mouth. Now I have dry mouth. Causes are inflammation, bleeding, deep ulceration, and death of gum tissues. So, acute necrotizing ulcerative gingivitis, trench mouth. Halitosis is bad breath. They have bad breath problems. But halito means breath. Osis, we know, means abnormal condition. It's where you have an unpleasant odor coming from your mouth. It's caused by dental diseases, respiratory diseases, gastric disorders, food you eat, things like that. Esophageal disorders, dyspepsia is where you have a difficulty swallowing, which if you break that down, it's pretty easy to remember as well. Pyrosis, pyro we know means what? Well, yeah, or like fire, things like that. So heartburn. It's a burning sensation caused by the return of acidic stomach contents into the esophagus. Esophageal disorders, so gastroesophageal reflux disease, or GERD. It's an upward flow of acid from the stomach into the esophagus. Stomach acid irritates and damages the lining of the esophagus. Barrett's esophagus, it occurs when the cells in the epithelial tissues of the esophagus are damaged by chronic acid exposure, and this develops in patients with chronic GERD. Hiatal hernia. It's an anatomical abnormality. It's where there's a portion of the stomach that protrudes upward into the chest, and it herniates through an opening in the diaphragm. I cannot speak today. So here's where that hiatal hernia is. The stomach's pushing it up right there into the esophagus. Stomach disorders. Gastritis, we all should get that one right, is inflammation of the stomach lining, often caused by bacteria, Helicobacter pylori. And gastroenteritis is inflammation of the mucous membranes lining the stomach and intestines. And gastrorrhea is excessive secretions of gastric juice into the stomach. Peptic ulcers are sores that affect the mucous membranes of the digestive system. It's caused by bacteria or medication that irritates the mucous membranes. Aspirin and anti-inflammatories are known to cause ulcers. And peptic ulcer disease is a condition of having ulcers. That's why it's important when we prescribe things like aspirin and things, you make sure that they're not forming a habit of it, only doing it in like short time frames. Especially if you're having them do like a regimen of it, where they're taking it like 2 times in the morning, 2 times at lunch, 2 times at dinner. You don't really want to do that long term. It should be a short term thing, so that way it does not irritate their stomach lining. Okay, gastric ulcers occur in your stomach. Duodenal ulcers or duodenal, either way, I've heard it said both ways, occur in the small intestines. Perforating ulcers is a complication of a peptic ulcer. It's where the ulcer erodes through the entire thickness of the organ wall. Not good. Aerophagia is excessive swallowing of air while eating or drinking. It's a common cause of gas in your stomach, which can be very uncomfortable. Eructation is an act of belching or raising gas orally from the stomach. It's kind of disgusting. Please don't do it over there, Griffin. I can tell he's like smiling like, I really want to do that right now. Dyspepsia, also known as indigestion. Pain or discomfort in digestion. Dyspepsia, that's kind of a fun word. Okay, emesis is reflux ejection of the stomach contents through the mouth. Hyperemesis is extreme persistent vomiting, can cause dehydration. Morning sickness can be a form of hyperemesis, which can be not a good thing if you're pregnant and you're throwing up all the time. You're supposed to remain hydrated and things. That can be a severe concern if you're having problems with morning sickness. It's not fun, I promise. Hematemesis is vomiting of blood, often resembles coffee grounds, kind of gross. Regurgitation is the return of swallowed food into the mouth. Ick. Oh, that's it. That's all we're going to do today. We're going to start here on intestinal disorders tomorrow. Be like little birds regurgitating food back up. Ugh.